Welcome back. Having diabetes or being at risk for diabetes can increase a person's chances for developing other health problems, including eye problems. We're continuing our discussion on eye health with Dr. Nottingham, and thanks again for being here.
You're welcome.
So I read that people with diabetes are actually 60% more likely to get cataracts. Can you talk about how diabetes affects the development of cataracts?
Yeah, like we were talking earlier, most people, if they live long enough, they'll develop cataracts. We tend to see cataracts develop in younger patients that are diabetic, mainly because the glucose, the ability to try and manage the glucose levels can affect the lens. So if somebody has elevated glucose levels at really high for a few weeks or a few months before they're even diagnosed with diabetes, that lens can swell, and then after they're treated and the blood glucose goes back to normal, that lens goes back to its normal size. So that effect on the lens can cause cataracts a little bit earlier in life.
Okay. Yeah. And I read too that people with diabetes are 40% more likely to get glaucoma. So what is glaucoma and why are people with diabetes more likely to get it?
Sure. Glaucoma is a disease of the optic nerve, and it's usually because of, or it can be because of, elevated eye pressure. And with diabetics, because it's a small blood vessel disease in the eye, when we have diabetic retinopathy, the ability for diabetics' blood flow to get to the optic nerve can be affected. So we do see a higher risk or higher prevalence of glaucoma in diabetics because of the blood flow perfusion issues to the retina.
Okay. So we already talked about why it's important to get a yearly exam, but why should people with diabetes be especially on time and making those appointments?
Well, the doctors around the Helena area do a great job in really pushing their patients to have exams every year, and it's important because diabetic retinopathy is a common and it's a common eye disease amongst diabetics. After 20 years, almost 90% of those patients will have some type of diabetic retinopathy. So on a yearly basis, we watch for those kinds of things, and if we find them, then we have the ability to get them to a retinal specialist if they need certain types of treatment to help with vision problems associated with retinopathy.
Okay, and what is that?
Diabetic retinopathy? Diabetic retinopathy is basically just a hemorrhaging of the retina, hemorrhaging of the capillaries in the retina, and when that happens, we can have edema near the macula, and that can cause vision problems. That's usually what patients will notice. So, it's mainly hemorrhaging of the retina.
Okay. Is it pretty common among people with diabetes?
Yeah, like I was saying before, anybody that's had diabetes, even if they're well managed, after 20 years of just having diabetes, 90% of those patients will have some form of diabetic retinopathy. Okay,
and so what are the treatment options for that?
There's laser procedures that can be done. There are Avastin injections, anti-VEGF injections that can be injected into the eye to eliminate edema associated with diabetes.
So whether it's diabetes or something else, are there certain things that happen with a person's eyes that they should be on the lookout for, symptoms that might indicate either retinopathy or some other kind of eye disease?
Yeah, I think anybody that has changes in vision that don't get better, anybody that has discharge, red eye, new floaters, any new visual symptoms that don't improve within 24 hours should see their local optometrist or ophthalmologist for care.
And how urgent is something like that? Have you seen patients that should have come in earlier than they did, and what would your advice be there?
Yeah, unfortunately, quite often. So certain eye symptoms are emergent, and we get those in my office. We get those patients in that day. Some emergencies can wait a day or two, but my advice is if you're having new eye symptoms, you contact your eye doctor and see when you need to go in.
Okay, so let's talk about what people with diabetes maybe can do to help make sure that they put off some of those symptoms or those issues, or is that possible?
Yeah, the biggest thing is yearly eye exams.
Okay. And then what about people in general who maybe don't have diabetes? What are some general tips you could give those folks for just trying to keep their eyes healthy as possible?
Sure. I would say yearly eye exams would be a starter, just so that if there is a problem, you can catch it early. Lubricating your eyes with a good artificial tear, especially with all the computer work and the telephone use that we do these days. Giving your eyes a break from some of those devices would also be a good idea for eye health. Those are probably the main ones. Sun protection too.
Okay,
Yep.
sunglasses.
Yep.
Okay, and you mentioned the eye drops. So for people who are out there trying to find something like that, what should they look for or make sure that something does not have in it?
I would say, I have certain products that I prefer, but I would say if you go to your local eye doctor and they have eye drops there, those are probably good ones. But Sustain, Refresh, I mean, there's many to choose from. Anything preservative free is usually a good route to go.
Okay, so do you want to look for something that says it's natural?
Yeah, I would look for, I typically personally use preservative free artificial tears. They come in individual little vials. That's a good way to go for anybody that's a contact lens wearer or not.
Okay, great. And so we're just about out of time. Any final advice you would give to viewers about eye health and keeping your eyes healthy?
I'd say protect your eyes with polarized sunglasses. And if you have any type of new eye symptom, seek care to your eye doctor.
Okay, perfect. Thank you so much. That's a lot of great information.
Thank you.
All right, we do need to pause here for another quick break. But coming up after this, we're going to talk about proper nutrition and how that relates to your eye health. Stay tuned. We'll be back in about 2 minutes. See you then.